continue on to the video, just need to be able to take a few seconds of your time. And so we want to be able to ask you a question. Are you looking to gain more referrals for your agency, your home health, your home care, your hospice agency? We want you to be able to join us at our online marketing bootcamp that has over 7.5 hours of training. When you actually watch our bootcamp and join our online marketing bootcamp training, you're going to get a free month access to our 10xpatientreferrals.com. So sign up for a limited time at 10xpatientreferrals.com and enjoy all the content. So let's go ahead and get back to the video that you're currently watching. Hey everyone, it's Michael here with Home Health Success Academy and 10xpatientreferrals.com. So first of all, for all you guys that are joining us in this webinar live, I just want to say welcome and thank you so much. Don't forget that, if you look to your right side, there is a place where you guys can actually make comments during this whole live webinar. We definitely want to be able to hear your comments and your a lot of questions that you guys have. And what we want to be able to do is when you do that, we will contact you later on and be able to answer all your questions. But we want to be able to, maximize the time that we have you here and really provide you guys with some amazing information. Now, the fact that you're watching this webinar, it is our 5 secrets to increase referrals to your agency. And just to let you guys know, there are things that I'm going to share with you guys that probably you guys are doing, but we want to be able to go into further detail. And if you actually use these 5 secrets, you'll be so amazed on what you guys can actually accomplish for your agency to be able to increase your referrals, because that's why we're in this business, right? If you're a marketer, your job is to be able to get more referrals so that you can keep your job. If you're an owner, you want to increase your referrals. Why? Because you want your company to stay afloat, to make sure that you can pay your employees, and at the same time, it's for you to make money as well, right? So that's our main goal. Before this webinar starts, hey guys, if you have your phone on, my truly recommendation is to put the phone down, put it on silent, and turn off the vibe mode, okay? So please make sure you do that. I need your full attention because we want to be able to get you guys all the information that you can. When you attend a webinar like this, any meeting, any conference that you go, most of the time there is a chance that you're going to forget 75% of what you learned. So make sure you pay close attention. Take some notes as well. Now, for you guys that miss this live webinar and you're watching this on our replay, that's perfectly fine as well. We want you to be able to make comments on our video down below as well. We want to be able to hear from you guys. Our goal here is to provide you guys with amazing information that's going to be able to maximize your marketing strategies for your company, okay? So that's why we're here. That's why Home Health Success Academy is here. That's why you're here, is because you want to learn certain things that's going to be able to be valuable for your company. Look, you open up an agency or you decide to work for an agency, you want to be able to make sure that you're making money. That's why we're in this business. Yes, we want to provide care. Yes, we want to be able to make sure our patients stay home comfortable where they keep away from the hospitals. But at the very same time it's a job. We want to get paid as well. So I definitely understand that, right? So I hope you guys pay close attention, take some notes, make sure you comment with us. And at the very same time, towards the end of this video, we're always going to share with you guys some amazing content as well. Some great, giveaways that we're going to be giving out. So please watch the video all the way to the end because we want to be able to give you guys as much information as possible. So let's go ahead and get started and talk about the 5 different secrets on how to be able to increase your referrals to your agency, okay? So let's go ahead and get started. The first secret, right? The first secret that you need to do, or pretty much strategy, right? When we say secrets, it's pretty much a strategy, it's a tactic. And what we want you guys to do is this. You guys can actually increase your referrals, not just from getting newer referral sources, but number 1 is go after your current sources of referrals. That's right, your current source of referrals. They can actually get you more patients. Because I will honestly be telling you guys this, more likely you're not the only agency that they are referring to, right? They want to spread it out, as they may say. So if it's a home health agency, where they bill, if you're a home health agency, home health patients where you bill Medicare, Medicaid, private insurances, there are some rules. And a lot of referral sources wants to make sure that they're not just referring it to just one agency. So that does not mean that you can't be the first choice to get the 5 referrals instead of the 1, or the second choice and get 10 referrals, right? Depending on what place you're going after. So what you want to do right now at this very moment is get the current list of referral sources that you're getting. So whether you're a home care or a home health and you're using a software, part of the software is that when you do an intake, when you bring in a new patient into your software, what ends up happening is there's going to be a part there, right? If you're using a really good software where you can actually put input and say, this is the source of the referral. Okay, so what you can do is you can pull up a report later on and say, okay, tell me who are my referral sources. Okay, so whether it's a physician, a nursing home, and just to let you guys know, is at some nursing homes, for example, we have 2 or 3 different referral sources because they have 2 or 3 different social workers or discharge planner. We don't just say, hey, ABC nursing home, it's just one source of referral. We actually want to make sure we write down who referred that patient to us. It's important that you have the name so that you can actually contact them correctly. So get the list of your current referral sources, right? Once you have that, the next thing you should be doing is look at how many are they referring to you. It's how are they averaging? Are they referring 5 patients a month for you? Okay, so let's say they've been with you for a year. How have they been doing the last 3 months? You want to be able to compare. Like if 1 month they go from 10 and then the following month they go 0, something's going wrong there. But month to month sometimes can change. So we more look at it at a quarterly basis, right? How much are they bringing in on a quarterly basis? Is there an increase or is there a decrease? By you knowing that, it's what's going to be able to help you guys really strategize things. At the very same time as when you look at these reports and all of a sudden, these happens a lot where you are doing so much and you're not paying attention that you actually lost a referral source, meaning all of a sudden that facility stopped referring to you, right? And you totally forgot about it. And this is why it is such an important thing where you must create a follow-up program and you pay attention. And you have to keep on visiting. Just because they are referring patients to you, that does not mean they're gonna keep referring patients to you. So it's always having a follow-up system that's important. You're visiting them. If a place is referring to me like 2-3 times a week, guess what? I'm visiting them every week. If they're referring once a month, maybe I'll visit them twice a month. Because I want to be able to look at the current referral sources and see, hey, who are they referring to? Now, for example, the next thing I would also look into is look at the diagnosis, the type of patients that they're actually referring to. So let's say, for example, this one doctor is only referring one type of patient. Let's say, for example, a patient that is CHF or COPD. I'm going to start looking and say, hey, why is he only referring CHF patients to me? Maybe he is not aware that maybe there are certain other types of patients that we can look at and educate them and say, hey, these are other patients that typically also needs home care services, home health services. Can we talk about it? Can we discuss certain things, okay? And one thing we also do is this. There's a software that we use that allows us to actually do a comparison, meaning that in this particular software, it is going to be some type of an investment for your agency. I truly understand that, but I want you guys to pay attention. In this software, we're able to see a physician, for example, pull up his information and actually figure out what are the top 5 diagnoses that he's taking care of. And do these top 5 diagnoses match the top 10 diagnoses of patients being admitted to home health? And because, if we can address this, we can start talking to the physician. This software that we also use, we are able to actually look into a physician's information and say, how many home health patients has he referred to in the past month, the past quarter, the past year, and so on. By us being able to see that amount of content, that information, that data, we can then say, hey, well, if he's referring these type of patients to home health, and when he refers them, they actually receive services, we're gonna say, hey, we're only getting 5 a month, yet he's referring an average of 50 a month. So where's that additional 45 patients going to? And in this particular software, we can even dive deeper and find out who are his top 5 home health agencies that he is referring to. Okay, so then it allows us to be able to actually see our competition and try to figure out what are they doing maybe that's different from our agency. So, this software is such a vital thing. It takes all the data coming from Medicare A and Medicare Part B, and then it puts it into the software and allows it to translate for you to be able to detail what you're doing. So that is a great software to be able to have. Now, look, if you don't want to spend extra money, that's your choice. I would rather spend money upfront to be able to maximize my marketing strategies. But in the beginning of my marketing days, this software was not available. There's 3 companies that offers this, and they've only been around for like about 2-3 years, right? So, one thing is we do strategize about going after our current referral sources and educating them. Educational-based marketing is one of the best ways to market your services. Not just the typical way of telling them everything about what you do, the services you provide, whether it's homemaker, caregivers, private duty, skilled nursing, physical therapy, occupational therapy, whatever it is, right? You don't want to just keep on selling your services and say, hey, refer to me. Everybody has this thing, psychologically wise, of what is in it for me. And so you want to be able to take advantage of that kind of psychological thing of every human being and say, hey, what can I do for you? It always has to have that mindset, is what can I do for you? And if they already have that relationship with you, they're already referring patients to you, well, guess what? Then it's going to be easier for you to be able to gain more referrals. So it works with nursing homes or hospitals. It does not matter. That's what you need to be able to do and strategize in doing things. Either or, it's all about education. So sometimes what we do is we have a different program, a different flyer that we give to a nursing home, different to a doctor, different to an office manager of physician's office, and also a different, flyer that goes into social workers for hospitals and nursing homes. You guys have to understand that you cannot have what they call vanilla marketing and think that you can market to everybody the same exact way. And the truth is, most agencies market the same way. When you go out there and you talk to somebody and they say, tell me about your company, the first thing they're going to do is what? We offer this, that, these. And can we get a patient and refer to you? We provide quality care. We're available 24/7. We want to be able to get this one time to show you that you're going to be able to enjoy our services. Everyone's going to say something in that level of things. And that is one thing you cannot do. You need to be able to have the mindset of asking the right questions to be able to know what can you do for them. How can you help them? So how can you help these current referral sources even more, right? We can actually even then go to a doctor, even if it's, that current doctor we're offering. If you haven't started this, and you're offering medical home health services, there's what they call the care plan oversight, right? Where doctors should be billing. So, hey doctor, have you heard of the care plan oversight? What are things that you guys can do right now for your current referral sources? Now, of course, follow-up is the most important thing. We go through all of our trainings. We have other videos showing you guys what you guys need to do to bring every time you visit. Those are in our other video series. But right now is just giving you guys certain strategies, certain ideas, certain tips on what can you actually do at this very moment to take care of your current referral sources, right? And what you guys can do also is, guess what? If, for example, these current referral sources stop referring to you within the past month, past 2 months, heck, even if they haven't been referring to you for more than a year, then what you can do is you can go back after them. But of course, you need to be able to find out, why did they stop referring to you? You want to be able to find out, did one of your caregivers do something wrong to their patients? Did your staff in the office do a poor job at answering the phone calls? Did your marketer do a piss poor job on following up and making sure they took care of these referral sources? You have to understand that there is probably some reason that you lost this referral source. Also, maybe another company came in and did a better job in presenting and provided better care. But let me continue on to the video. Just need to be able to take a few seconds of your time. This video is brought to you by medicationreminderprogram.com. Are you trying to look for that one edge up to be able to get you more referrals or to get new referral sources? Well, that's medicationreminderprogram.com. If you start offering this for your patients and future patients, you're going to be able to show future referral sources that you're doing something different, that you're providing better services than your competition. The Daily Reminder program goes like this. We will call the patients for you twice a day and remind them to take their medications at 9 o'clock in the morning and at 5 p.m. A top reason for hospitalization of seniors is not taking their medications. So what you're going to be doing here is you're going to be giving them comfort of mind, both family and referral sources. So sign up to medicationreminderprogram.com right now. There's 3 packages available, but at the very same time right now with code 50 off, you can actually get 50% off our Gold plan and the Platinum plan. So just stop by medicationreminderprogram.com and let us help you get more referrals. Let's go back to the video you're currently watching. If they have referred to you in the past or they're currently referring to you, then you can probably get them back and get them to also either increase more referrals coming your way. It's about paying attention, paying close attention, and communicating with them. And so those are little things that you want to be able to do, right? You want to follow up. You always want to make sure that you are omnipresent, meaning that you are present everywhere. That when they think of home health, when they think of home care, they think of you. Okay, so that is secret number 1, which is go after your current referral sources. If they are already referring to you, that does not mean that you can't get an extra referral or 2, or even double up your current referrals coming from that potential referral source already. So secret number 1, go after your current referral sources or past referral sources. Now, secret number 2 or strategy number 2 is how to get old referral sources back or get new referral sources, right? So if a referral source stopped referring to you for more than 6 months, I will pretty much say that that agency or that referral source has gone cold. And I have to treat them just like a new referral source, okay? At the very same time as to increase your census to get more patients, you have to also keep on bringing in new referral sources, right? Because it is true. No matter how good you are, no matter what you do, there's a potential that you're going to lose current referral sources. That's just part of the game. It is the truth. And I'm not going to lie. I've lost referral sources. I've lost referral sources that, they can't even tell me why they decided to move to another agency. They just forgot. Or maybe they just don't want to answer the question when I ask them, hey, what made you choose to decide to move to another agency? I know you're not working with me, but I definitely want to be able to find out. Right? You have to ask these important questions. If you can't ask the questions, then you shouldn't be in marketing. You shouldn't be in business because it's about finding out what are the current problems or things that they need help with. So let's go ahead and how do we target old referral sources that hasn't referred to more than 6 months or getting more referral sources? Number 1 is creating a list of targets. You have to create a list. You can't just say, I'm going to target all of these doctors, or you can't say, I'm going to target all these nursing homes. No, you have to be specific. If you're going to tell me you want to be able to go after 200 potential referral sources, let's say we do a mix of 100 doctors, 50 nursing homes, 50 assisted living facilities, and you want to go after all those 200, I'm going to tell you guys that that's overshooting the whole thing. What I want to be able to do is maybe narrow it down to maybe 100 to 125 or even up to 150 potential referral sources, depending how good your marketer is. The goal is when you target new referral sources is to be able to actually visit all of them and follow up with them every week or a minimum of every 10 days. If you can do this, that's going to maximize your potential, increase in referrals. Why is that? Well, this is a relationship game. It really is. For you to be able to get referrals from these companies, you must be known, liked, and trusted. And the number 1 reason why a lot of agencies like yourselves, your home care, your home health agency, is not getting referrals is because they are not known. People don't even know you guys exist. Why don't they know you exist? Because it is busy out there. The traffic is amazing because there's too many competition. Now, some of you guys say, well, Michael, yeah, we have a lot of competition. And when I ask them, okay, how many competitions do you have? And they say, well, I don't really know. In the hundreds, maybe? That's the thing, guys. You should know how many competitors are in your area. You should know who are the top 15, top 20 that shows up in a search. You should know who's ranked, the 5-star or 4 stars out there. These are important things that you should have, but we're just going right now after how to get new referral sources. So you need to be able to get the list, have the list created, and then you need to strategize them by making sure that you do what they call, you put them together in certain areas. What you need to be able to do is like, hey, how many people is in this particular part of the region? Who are in certain areas that are close by? Why you want to be able to do that? Let's say you're going to target 100. What you're going to do is you're going to find out, hey, who are close by to each other, so that when you do that marketing on a Monday, you're going to visit all of these places that are close by to each other to minimize the drive time, to minimize the loss of minutes and hours in the traffic or driving zigzagging across town, so you can maximize your visits and visit them more. Like I said, you want to be able, when you're trying to go after a new referral source or an old referral source that stopped referring to you, you need to treat them really good. And you need to create that relationship all over again. So how do you create relationships? Imagine a lot of your best friends or your close friends that became close to you. Those are the people that are in close proximity to you. You always see them. They're always around. Wherever you go, they're there, right? Sometimes you see them when you don't want to see them. It's the same exact thing to create a relationship with potential referral sources. And that's actually to be there in front of them all the time. And I'm not saying every day. I'm not saying every week you're going to try to get a 30-minute meeting with them. No, you want to just have a good follow-up. And so the follow-up system that we share with you guys in our 10xpatientreferrals.com website, in our online training, is such an amazing follow-up system that if you actually implement that with your marketing strategies, you'll be surprised how higher of a ratio you're going to get of conversions of new referral sources, right? So create that list, right? And then what you're going to kind of do is, like I said, find out what's your decision? Are you going to visit them every week or every 10 days? You want to be able to create that calendar, right? Best way to do this is using a customer relationship management software, also known as a CRM. It allows you to be able to communicate with anybody in the office, with the marketing team, with the administrators, with the owners. It's such an important thing. Plus, also, you can put so much information in this software that you will have a great idea about that potential referral source, so that when you revisit, you already know maybe their first name, their last name, their position, their email, their direct cell phone number. Maybe you might figure out other family things as well. How many kids do they have? You can write those things in. Those are little strategies in what they call your black book strategy. So these are things that you need to be able to kind of start looking into. The next thing is you have to be able to also find out, how and why they chose an agency, right? So like I said, you don't want to be able to just push your services and your products. When you're meeting with them, when you're marketing to them, you must be able to answer certain questions. And I'm a little sweaty, I apologize, but I'm going to keep on going. All right, so, looking at the hows and the whys. Hey, what made you choose to work with agencies in the past? Or hey, what made, if they're old referral sources, what made you choose to work with us in the past? What made you choose to work with another agency after us? You want to be able to ask the tough questions. Great marketers, great salespeople, great presenters are able to ask the tough questions, but to be able to provide the solutions and the answers on why they are the people of choice. So that's something that you guys need to start really looking into when you're doing this. So these are just some of the things that we want to be able to share with you guys on how to go after newer referral sources, and at the very same time as old referral sources as well that you lost. And also, you must be great in objections. Like I hear so many times, I walk in the very first time and they say, hey, we are already working with another home care company. And most marketers out there will say, well, here's my brochure, here's my information, here's my card, here's my pen, my mug. Please give us a call. Try us this once, you won't regret it. We provide quality care, our staff is amazing, blah, blah, blah. And that's it. When the best answer is to say this, hey, listen, I completely agree with you. The moment I walked in that door, I already knew you're already working with another agency because you've been here for a while. And then I ask a tough question, right? So you must be able to be good at handling objections and asking questions. And we go through this in our whole boot camp that we have available, and also in our 10x Patient Referrals Online Academy. It's such an amazing thing, but we're just trying to go after, I want to fit as much information as I can in this webinar for you guys. So if you have questions, don't forget, like I said, ask the questions. We have somebody monitoring that because we want to be able to go ahead and give you guys some private answers with that, okay? So That's important information. The next thing is you want to be able to start having a presentation. When you visit somebody for the very first time, they may give you an objection. They may not have any time to meet with you. So your goal is to always try to get that appointment, because that's the main thing. Getting an appointment, getting that presentation, right? Whether it's that 5-minute pitch or that 15-minute pitch, it does not matter. The goal here is don't get worried or don't be sad if you're not able to, get a meeting right away or get a presentation right away. Sometimes it's going to take time. I've seen it where it takes us 5-7 visits before they finally say, hey, we definitely want you to come by to do a presentation. Whatever it is, you must be willing to work hard. Nothing is worth anything. Nothing's worth so much unless you can work hard for it. That's the best thing about this, right? And a lot of companies really do bad with the follow-ups. And a lot of companies don't even do a good job of presenting. You must have a sales process in place. From prospecting to qualification to presenting to closing and to follow-ups. If you have a presentation strategy, a marketing blueprint strategy that we share with you guys, you'll be surprised on what you guys can do. But if you cannot measure what you're doing, if you don't have a process, then it's going to cause problems with you and your marketers in the future. So that's, secret number one or secret number two, strategy number two is how to be able to go after your old referral sources or getting new referral sources to increase your census for your agency. Let's move on to strategy or secret number 3. Okay, everybody, so let's talk about the strategy number 3 or secret number 3. Now, in this particular strategy, it's really more of a mindset kind of. The mindset that you guys have, that you should have when you're marketing your company. Okay, so a lot of times is that, we are just so bombarded. We want to just go after all the nursing homes, all the physicians, all the doctors, all the, assisted living facilities, right? And you have to have this one mindset. If you're a marketer and you're a successful marketer, you're thinking of the one at a time strategy or the one at a time mindset. I see a lot of marketers, they're trying to go after the big fishes sometimes, meaning they're trying to go after that hospital. And because, they're doing everything possible but without a plan and not pretty much hooking a fish and getting them to start referring to, a lot of times marketers will end up, kind of having a negative concept, a negative idea. And they're going to start having the idea of always or never, meaning that they're always working with another agency and they're never going to refer to us, or they're working with another agency because, that agency's paying them money under the table or something like that. So you have to have the one at a time strategy. All you need is that one referral sources, that one new referral source. Just like we go back to secret number 1, where, if you have current referral sources, what you do need to be able to market back to them and maybe get them to start increasing your services. You just need that one referral source that if you get that only one referral, maybe one referral a month for the first 3 months, right? But then they start believing in you. They start seeing that they want to work with you. They may start giving you guys more. So instead of trying to go after those facilities that's going to potentially refer 10, 15 patients to you a month, go after the ones that are not being visited a lot. You'll be surprised that, sometimes people don't even go after certain physicians or go after certain nursing homes or certain ALFs because, they're not getting referrals. So you're just after that one new referral source. You're after that one first referral they can give you. You're looking after that one first visit. Just go there and use the idea and the mindset of a one at a time strategy. At the very same time, it goes into the idea of your follow-ups, right? A lot of people, when they go after a company, they visit them only once. And when they hit failure, when they don't get a referral, they stop coming back because they come up with their own objections saying that they're already working with another agency. Well, guess what? Of course they are. Not unless it's a nursing home that's just opened up brand new, right? No, more likely they are working with a current agency, a current home health agency, a current home care company. But that does not mean that you can't go after them. Just do it one at a time, one visit at a time, one follow-up at a time. It's for you to be able to gather as much information. Now, there's statistics out there that says in sales, it takes about 7 to 10 touches before you can actually generate a potential business or referral. So how many times are you visiting? Are you taking that one more visit strategy? one at a time strategy. Just thinking about that is such an amazing thing that you guys need to be able to have, right? All you need is that one referral source, that one referral at a time, that one visit, that one follow-up, that one presentation, right? That is all you need. But guess what? You must have, some goals in there as well that you want to be able to attain. Like for example, if I call somebody and do a cold call, I don't know the facility yet, I don't know who the potential referral source, I'm not expecting a referral the first time I give them a call. And it's very rare that you get a referral just by calling somebody, just by doing a cold call on somebody, right? So my goal on that first call is to get the name of the person that I want to speak to. So I want to get a hold of the social worker, the discharge planner, the office manager. I want to be able to get their cell phone number, their email, some information from them, that one information that I can get that moves me up to the next part of my whole strategy, right? I want to be able to set up and get that appointment, right? That one appointment. Just imagine, right? In one day, right? If I do what we call a cold call blitz, if I'm going to start a new marketing campaign, I'm going to call 100 places. And I can do that within one day, right? Give them a call. And guess what? If out of those 100 people I call, and every hour, right? Let's say I call 20 places every hour, all right? And I call those 20 places, and I can actually get one meeting, one appointment set up to be able to have a presentation every hour. That's that one appointment. Now I need to be able to have that one appointment, right? And then close them as much as possible. So 1 hour at a time, one call at a time, one visit at a time, one presentation at a time. You have to have this type of mindset in order to be able to market your company, right? And you don't want to be discouraged if there are certain failures. Failure is just one more step to figure out what you need to do right? And so you want to be able to start having this mindset, right? By being able to have that one more referral. And so it goes back to secret number one, right? Where we follow back with them. That one extra follow-up to ask the question on how we can actually get more patients, or that one presentation say, hey, you're currently, providing services, and giving referrals for cardiac patients. Well, how about your diabetics? How about those type of patients? They may need our services. How about your post-ortho patients? Maybe they need our services as well. So working with that mindset, the strategy in your mind, that's secret. And some referrals, some marketers out there, unfortunately quit right away and don't have this type of mindset. So think about this mindset of having that one at a time setup, but at the same time is making sure every step that you're doing, you're trying to accomplish one more step that gets you closer to that potential referral source. They literally say, a no is not a no, but you know certain things about them, right? Because eventually you can turn a no into a yes, and that's your main goal. Let's move on to the fourth strategy, or the fourth secret, right? And that's going to be going after the right target. It's true, guys. You have to go after the right target. Sometimes, unfortunately, we go for all but not even hit one, right? The whole concept of I just want to be able to, grab, let's say, for example, you think about, one of those automatic weapons, right? Those guns, and so, you're not good at what you're doing. You haven't practiced yet. You didn't go to practice to the gun range. You have no idea how to use a weapon. Guess what? The strategy for some people is just spray the bullets and hopefully hit something. But a lot of times is you're not even going to hit anyone at all, right? And so you're not going to hit any of those moving targets or any of those regular targets. So, by having the right strategy, right, part of that is targeting the right places. And this comes into mind in regards for your prospecting, right? So if you actually attended our marketing bootcamp, our online marketing bootcamp, or our live bootcamp events, we talk about the Home Health Success Academy blueprint, or the whole process of the whole sales, right? And part of that is prospecting, meaning you're going after the good places, right? And we talked about a software earlier on that we use. That's actually going to make it even easier for you to be able to figure out who are the better targets, because you can find out who's the top physician referring home health patients in your area, who is the top nursing home that has the most referrals as well. So this allows you to be able to be more specific. So I'll give you a quick example. I was working with a marketer, and he was saying, "Well, Michael, I'm not getting referrals. I'm not getting referrals." And to be honest, he was actually using one of these softwares that was available. And what he was doing was that he was going after physicians, but he was going after the wrong physicians. Now, I'm not saying that the physicians he was going to or he was going after are not good sources. It's just that these are what they call low utilizing physicians, meaning yes, they have a lot of patients that are Medicare patients or a lot of patients that end up needing home health services. But these are those physicians that unfortunately don't refer to the home health. Their patients, they let the primary care physicians refer them. And so they will be great to provide education to and say, hey, maybe you should start referring these patients directly so that we can start the care as early as possible. And you can convert them, and that's great, but that's what they call high amount of patients, but low utilization. And so it's going to take a little bit more steps to educate them to maybe put it in their process that they should be doing this. Because for a long time they weren't, so why are they going to start now? So this is where you have to have some education stuff in there. It's going to take a little bit longer. I would rather target, maybe a physician that has low amount of Medicare patients, for example, but is utilizing home health at a high rate. Meaning, let's say they have only 20 patients that have Medicare, but they're referring 17 of those to home health on a monthly basis. That physician is a lot better to target than a physician that has maybe 200 Medicare patients that ends up in home health, but they are not the ones that actually following through or referring them to home health. It goes at the same time as for nursing homes as well. Who are the right targets? There are going to be some nursing homes that unfortunately you'll find out owns their own agencies, right? Their own home health agencies. Are they still a good target? Of course they are. Because one thing is they cannot refer all of their patients to their own home health. They have to spread love around. But at the same time it's going to be a lot extra steps to target those. I would rather go after the nursing homes, the skilled nursing facilities that do not have their own home health agencies, okay? It goes the same exact thing with the doctors as well. Now, for example, for you guys out there with non-medical companies right there, non-medical private duty, you're taking advantage or using, for example, a place for mom, these, referral sources that they're going to refer a patient to you guys. There's nothing wrong with these places. You're paying every time that they refer a patient to you. But when you pay them per referral, they're also referring those patients to other agencies as well. And they're collecting $35 from you, $50 from you, $50 from the other, $50 from the other agencies. And they're making their money while you guys are competing against the others. And so it's going to be the first person that can actually present it better, the first person maybe that contacts this patient. So you have to be faster. So the thing though is, are you targeting people the right way? Are you targeting where you need to be able to go after that? There's people that advertises in the newspaper. Guess what? Nobody is picking up newspapers nowadays. When's the last time you actually picked up the paper? Honestly, think about that. When's the last time you picked up a paper? Now, guess what? If you're marketing your company, right? If you're doing the right target, are you, is your advertising in the 57th page? Well, when's the last time somebody of the age you're targeting has a family member that actually opened up page 57 of a newspaper? So you have to go after the right targets. Now, let's talk about the right targets, right? Best targets to go after is in the nursing home. But when I ask this question a lot is, who are you targeting in a nursing home? And I'll hear marketers say, well, we go after administrator, the DONs, and the social workers. Those are all three places that you should target maybe, but who's the prime target? It's the social worker and discharge planner. Why are you wasting time to go after the administrator? Yes, there are some facilities, I'll be honest with you, that the administrator makes a decision, but that's just a micromanager. The truth is, majority of nursing homes, it's the social worker and discharge planner that makes a decision. Why even go after the DON? All that DON, their job is to handle patients inside the facility. They're not really worried about when the patient leaves. Their goal is to get the patient home as soon as possible or get the patient converted into long-term care. Go after the social worker and a discharge planner. When you go into assisted living facilities, who's the right target there? A lot of people will say this administrator. No, it's called a wellness director. Most assisted living facilities have what they call a wellness director, whether it's an LPN, practical nurse, or an RN. And their job is to actually outsource any services. If a patient needs wound care, if a patient needs, home care, caregiver services, they're the ones that will reach out to companies. So you want to go after the right targets. Okay, you have to be more specific about these type of things, right? So you want to be able to research. The next thing is, when you create your target, I said this earlier on today, is when you try to do a new market, you want to be able to target maybe 20 to 25 visits a day, which is about 100 to 150 potential new referral sources that you're going to visit on a weekly basis. This is if you're doing a new marketing blitz. Now, let's say, for example, I already have a good maybe 30 referral sources a month. 30 referral sources that refers to me on a monthly basis. So I'm not going to target 150, right? Because I still want to make sure I'm visiting my current referral sources. Never forget your current referral sources. Sometimes we forget that. So if I want to bring a new target mix, I'm just going to go after maybe 100 to 120, because that's all I can include in my schedule of 40 hours a week, right? I still want to visit my current 30 referral sources, right? So if I want to have new targets, I want to go after a new 100 to 120. But the truth is, it's going to be lesser than that as well, is because I have other facilities that I'm still trying to generate referrals to, so I still want to follow up with them. So you have to be able to know what's your target list, right? If you're new in an area and you're going to market, you have to visit 100 to 150 if you are able to have a full-time marketer, right? Whether it's you marketing or your new marketer that's going to be marketing, right? And you must be able to know who you're going to be targeting within that facility. It is very important that you have that idea, that you know what you're doing. So let's go through that, right? Knowing who you're going to be visiting in the facility. Is it the social worker? Is it the discharge planner, right? Is it the administrator? Is it the wellness director, right? And a lot of times when you go to doctor's offices, for example, a lot of people say, well, I want to speak to the doctor. The truth is, who cares really about the doctor? Yes, he writes the order for the referral, but most of the time it's the office manager who will then call the home health agency. Just imagine that. That doctor is not going to see a patient and then stop what he's doing, pick up the phone call and call a home health agency and say, hey, I need you to provide care for my particular patient. No, he wants to maximize his visits daily, that he gets to see a lot of patients. So he's going to stay seeing patients one after the other. Anything that needs to be outsourced, he then gives it to his office manager and says, hey, refer them. So that's the thing. Sometimes I don't even bother presenting a physician. I just go after that person, right? That manager in the office to handle that. So these are things. Know who you need to be able to speak to within an organization. And it's different from each facility. And sometimes that's why we continue on to the video. Just need to be able to take a few seconds of your time. This video is brought to you by one of our sponsors, HomeCareAnsweringService.com. So our job here at HomeCareAnsweringService.com is to be able to make sure that you stop missing any calls, because we're going to handle the calls for you 24 hours a day, 7 days a week, 365 days of the year, even during the holidays. So mostly we're going to be doing a lot of your after-hour calls to be able to give you some time to be able to rest rather than staying up or waking up in the middle of the night to answer any phone calls coming in for your home care, your hospice, or your home health agency. It's also going to be able to help you guys reduce the cost. Instead of hiring a full-time receptionist, especially if you are in the beginning process of starting your business, you want to be able to reduce your costs at this very moment. We are HIPAA compliant. Also, when we want to contact you, we can send you messages via text message, via email, or even via leaving a voicemail in your current phone. Another thing is we are just one price service, right? We don't charge anything different for our after hours on our morning hour calls. Also, remember, we are industry specific. We only work with home health, with home care, and hospice agencies. Also, it's a month-to-month program. We don't have any yearly or 2-year contracts. So you just pretty much pay as you go. Now, we have 3 different plans. Typically, most of the people will sign up with our silver plan, which includes 100 minutes a month, which is $99 a month. And any additional minutes after that is just 95 cents. If you are starting your agency, you can start off with the basic plan, which is $39 a month, and you get an instant 20 minutes per month available for you. This is really good if you're just starting off your agency and you're still working a full-time job and you don't want to miss any phone calls. So sign up at this very moment to HomeCareAnsweringService.com and stop missing those calls. Sometimes that's why you need to ask the question, who makes the decision, right? Who is the ultimate decision? But if they say, for example, in a doctor's office, well, the doctor, puts in the order. Hey, I completely agree that the doctor will write in the order. But once a doctor figures that a patient needs services or needs home health, who does he hand it off to in the office to make the call, to call the facility, to send over the information? By you asking that question, right? By you asking that question, you're going to get the answer. And they say, well, I do it. Perfect. Well, I want to speak to you first and speak to that person directly. Those are one of the things that you guys want to be able to do. Now, what we want to be able to share with you guys is so much information. I hope the information we're giving to you guys right now is actually really working and your guys are really paying attention to what we're sharing with you. So have the right amount of target, the numbers, be specific. Don't go over too much, right? Because you're just going to drive yourself crazy and you're going to minimize your visits, your follow-ups, and that's going to cause some problems, right? And then at the very same time is be specific. They literally say is have an avatar, right? An avatar is the ideal customer, the ideal person you want to be able to go after. What are their needs, their wants? What are things that are lacking that you can provide better services for? Once you're able to create that right there is going to be able to generate a lot of things for you guys. Like, for example, if we're going after non-medical patients, we're going to market in Facebook, for example. We're going to do a bunch of Facebook marketing strategies. So then let's be specific. Who's our right target? Are we targeting patients? Are we targeting, the client that needs a home care service? No. Our target are their kids. So we're targeting, instead of the 65 and plus, we're targeting the people who are 45 to 65 years of age because their mothers, their fathers, right, who are 20 years probably older than them, are the ones that needs the services. So just think about that, right? We're targeting 45 to 65. That's the demographics that we're going to do our marketing or our advertising targets, because you can do that in Facebook. You can choose, because you don't want to advertise somebody who's 25. They're not the decision makers for care for their grandma. It's the older siblings. It's the kids, not the grandkids. Sometimes they do, but it's very rare. So we want to maximize our marketing spend to the right people. So we're going to hit them and say, hey, 45 to 65, this is the advertising. And we have a whole course on Facebook marketing that you should definitely take advantage. It's on our 10xpatientreferrals.com training. It is amazing because you'd be surprised how home care, non-medical private duties can take advantage of Facebook marketing to be able to increase the chances of referrals as well. So that right there is secret number 4, or strategy number 4, meaning going after the right targets. Let's move on to pretty much secret number 5, or strategy number 5, however you want to call it. And that is knowing what to present, right? One of the biggest problems we face is marketers not knowing how to do a great presentation. They start mumbling. They start giving gibberish answers. They can't even pronounce or say the services that they offer. The basic 5 things maybe, right? So you want to be able to make sure that you're able to present what is meant for that particular person, right? So a good way to be able to ask a question is, when we go to a facility and we say, hey, we want to be able to share with you our information about our company, and that person we want to talk to, that decision maker, will say something like, well, tell me about your company. Most marketers, the people who are not experienced, right, will then go into the spiel. If you're a home health medical, you can say, hey, we're a home health agency. We were established in 2010. Our website is this, and we offer skilled nursing, physical therapy, occupational therapy, home health aides, and medical social workers. We have amazing, amazing staff. They provide quality care. We're available for you. Just give us a call. We have a 24-hour on-call service. So and so, right? And that's it. Right? And then that is going to be causing a problem, because what you need to really do is pay attention and know what their buying criteria is. Other than that is the part that, remember, there's what they call the 80-20 rule. The 80-20 rule is pretty much saying that you need to be able to listen 80% of the time in presentation and be able to talk 20% of the time. The reason for that is that you need to understand that it's having that what's in it for me psychological setup. And so a referral source wants to be able to have that kind of psychological greediness where what can you do for me? What can you, for your agency, do for my nursing home or my patients or my time? And so when you have that mindset, when you know that that's what they're thinking, now your job is to be able to ask a question and have them talk. Because whoever talks more is going to lose. Why? Because the other person gains more information about that company. So if you talk too much, they're going to get more information from you that maybe they're going to say, I don't want your services. But guess what? If you get more information from them, then you have something in your hand on how to follow up and how to present. So a good question to ask is like, hey, what are 3 things that made you choose to work with agencies in the past? By me asking this particular question, it allows me to be able to find out what's their buying criteria, what made them choose to work with agencies in the past. If I ask them a question such as, what are 3 things that if those agencies you're working with can improve on to provide better care for you and take care of your patients, what would those be? Guess what? Now I know what's going to make them want to move away. And then I set up my whole presentation around the information that I gathered from them. And typically, like I said, one presentation does not mean you're going to get a referral right away. Does it happen? Of course it does, but not always. It's your follow-ups. So the information I gathered in those 2 questions, just those 2 basic questions, we have other questions that we're going to ask all throughout, closing questions. And that's, once again, like I said, it's on 10xpatientreferrals.com. There's so much information that we have there, close to over 200 hours of training, that we can't really fit all that in this webinar that we're doing with you guys at this very moment, right? So imagine that, right? I have 6 things, 7 things, maybe 10 things that they shared with me by asking those 2 questions. What I can do now is break down those and answer those questions, because those are what's important for them. And guess what? It allows me to be able to have something to educate them every week that I actually visit them. Imagine that. I'm actually giving them the information that they need, that if they can have, they can make a decision on what they want to be able to do. Figure out what is their buying criteria, what's going to make them, or what has made them choose to work with an agency in the past, and also find out what are things that the current agencies are doing that they can improve on, right? It's the same question of asking what are they doing wrong or what are their mistakes that they're doing, but we don't want to be that negative marketer, right? We never, ever want to be negative. And so we can ask a question and still get the same answers, and that's why we ask, what are 3 things that if they can improve on, right? Improve, meaning they're doing something wrong. Improve instead of, improve is a better word than asking them what are they doing wrong, right? And so, because sometimes if we ask what are they doing wrong, that means we're telling that referral source that, hey, you're doing something wrong, and we never want to accuse that, right? So you want to be able to know what to present, okay? The next thing is when you're presenting your services, let's say you are talking about skilled nursing or you are talking light housekeeping, right? Don't talk about the features, right? Never about features, right? Yeah, you can talk about it and say the word, but you must also include the benefits. How does this benefit the client, right? How does it allow, if they use your services, it's going to benefit? Like a good example for what we do, and this goes for our home health agencies, medical and also non-medical. So we always do something where we share with them what makes us stand out, right? And so, and that's the next thing is you must share something that makes you different from other agencies. So that's an important thing. So a good example is this, is that we provide a medication reminder program, meaning that every patient that we admit will get a call twice a day at 9 o'clock exactly in the morning and at 5 o'clock in the afternoon. Exactly 5 p.m. and exactly 9 a.m. They're going to get a call to remind them to take the medications. Because medication non-compliance is one of the biggest reasons why patients end up back in the hospital or end up back in a nursing home. And that's something that you want to prevent, and you want to show them that, right? Now, guess what? Most home health agencies, now saying 99.9% of agencies, of home health medical agencies, do not offer a medication reminder program. Yet they want to provide care. Guess what? Because your nurses are only visiting once a week. Their therapist is visiting once a week. So how can they call them on a daily basis? Right? So we work with a company that we actually own as well called medicationreminderprogram.com, where for as low as $10 per patient a month, they're going to get a call every day, twice a day, including the weekends as well, when your office is closed. So we do that on a continuous basis. So we can tell a referral source, say, hey, just to let you know, we are probably the only agency that offers this type of service, this automatic calling service. So that right there makes us stand out, right? So that right there is an amazing thing that we can actually do. So you must be able to know these things and do these things right now at this very moment, okay? So what are you doing that's gonna make you stand out? Don't just approach it by just targeting the features when you're presenting, but show them the benefits of if you do this is what happens with the patient. This is what's going to be able to be remarkable. We also share also features on what we do. Like, let's say, for example, a referral source, they say one of the biggest things that makes them make a decision to work with an agency is the communication, right? So what are you doing right now that provides them the ability and show them that your communication is better than the other agencies? So, one thing that makes us stand out is that we have, our staff in the office are able to answer video calls as well. So we tell them, say, hey, if you prefer a video call to speak to one of our office mates, our office staff, that is available for you, right? Because we want to be able to approach every single way of people, how they manage their conversations or communication. We want to tell them, hey, we're available by text. We're available, actually there's these two services called Viber and WhatsApp, which is an app in, Android-based phones and also iPhones, and so we actually come across several referral sources that prefer using Viber and WhatsApp to communicate. And we have that ability, we have that ability to be able to do that. And it's really something that makes us stand out, right? Talking about another, thing that we do, we have what we call an emergency button, right? Every patient that gets admitted to our agency, both non-medical and also medical home health, gets an emergency button, meaning if a patient has an emergency, they can press that button and be able to get in hold of 911 right away, an emergency responder. It's able to be able to help them, right? But at the same time as when they press that button and somebody will answer, and this is a third-party company, and they will not just call 911 right away. They're going to try to communicate because it's like pretty much it's a two-way cell phone, but you only just press one button and it goes straight to them. And if the person's not responsive or not responding, or really if something's wrong, then they'll call 911. But if they can resolve it right there, what they'll do is they'll actually patch in the call to us into the office and say, hey, one of your patients is actually, having a problem, or calling in and press the button, had an emergency. Maybe it's a fall. Maybe we can get somebody to them right away. What can we do to keep that patient at home longer, at the comfort of their home, where they belong, instead of going to the hospital or a long-term care facility? So those are the little things that you have to be able to understand. And I want to be able to make sure that you guys pay attention to these 5 strategies, right? So let's go ahead and just get started with the different strategies. Number 1, you need to be able to get more referrals from your current sources. So you want to be able to, number 1, approach them again. How to be able to get more referral sources, maybe double, maybe just get an extra 20%. That may be helpful for you. The number two secret is how to get old referral sources back, or getting new referral sources as well, because that's what's going to increase your referrals as well. Number 3 is one at a time strategy. If you have that mindset of a one at a time strategy, it's going to be able to be helpful for you. And at the same time is not put a negative mindset into you. The 4th strategy or 4th secret is going after the right targets. You must be specific and you must know who to target. Now, I wanted to share with you guys some amazing information, so please keep on sticking through this presentation, because I want to share with you guys something that's going to be beneficial for you guys to help you guys really, really go to the next level. And the 5th strategy and 5th secret is knowing what to present. You must be ready to present your services. One thing that we do is, like we said, practice, drill, and rehearse. We really want to be able to make sure that our marketers know how to present in front of us. If they can't even do a great presentation in front of us as a team, guess what's going to happen? They're not going to be able to do that in the real world. So you want to be able to provide them training. So let me go ahead and share with you guys right now at this very moment some amazing information that you guys probably should take advantage of at this level to be able to move you guys to a more successful level in your marketing. So let's go ahead and get started and sharing that with you guys right now. Hey everyone, we want to be able to invite you to our 10xpatientreferrals.com, where we have our online home health marketing academy that's going to be able to help either a home health, home care, or hospice agency increase referrals, increase their census, and create a profitable company. Now, at this very moment, you're going to have access to these information through these training, marketing to physicians, how to get to hospitals, how to be able to get into nursing homes, and much, much more at a month-to-month basis with no contracts needed. It's just month to month. Now, guess what? We are offering you guys for a limited time 50% off any one of our plans. Just choose which one is going to be able to work better for you. So just stop by the 10xpatientreferrals.com at any given moment. So these are the plans that are available, whether it's the gold, the silver, or the platinum plan. Most people go for the gold plan, but it's up to you what's going to work for you. We definitely want to be able to have you come in and work with us. So here's two choices. Go to 10xpatientreferrals.com or click the link down below. Take advantage of this right now at this very moment and sign up with us.